Welcome, everyone. So my name is Cassandra Lepac, and I am the Chief Business Development Officer for Aclaro Medical. But first off, I want to thank you all for taking time out of your busy schedules to join us for this highly anticipated virtual event. We will be learning firsthand from industry-leading expert Dr. Paul Friedman and his cosmetic fellow, Dr. Taryn Murray, who will be discussing this novel new mode called laser coring, which is now available on the UltraClear Cold Ablative Fractional Fiber Laser. This evening, we will be providing an overview of our technology, including a pre-recorded treatment demonstration, healing progression photos, before and after photos, and a live Q&A session. So grab a bite to eat or your beverage of choice, and let's dive into learning more about the first resurfacing disruptor in decades, as well as the first laser-assisted tissue coring technology. With over 30 years' experience in the industry, our Aclaro team of experts offers a nimble approach to addressing practice needs, providing a better experience from the patient to the provider and to the practice. Commercially launching in April of 2022, we are partnering with some of the top dermatologists, plastic surgeons, and key practices around the world. UltraClear is a novel, fractional, cold ablative fiber laser, which is FDA cleared for fine lines, wrinkles, scar revision, acne scars, and so much more. Most recently launching our newest mode, laser coring, we are continuing to validate these in-practice applications through histology and clinical studies. As depicted here, with 6 applications, a single handpiece, and no consumables, this revolutionary fractionated ablative resurfacing laser is incredibly versatile. With an easy-to-use guided user interface, providers can quickly move from mode to mode, shortening treatment times and optimizing outcomes for their patients. Superficial treatments with our clear mode, including our 3D Miracle treatment, are performed comfortably and quickly, typically in less than 10 minutes with no topical anesthetic. As you will hear from Dr. Paul Friedman this evening, where UltraClear shines is the ability to provide more aggressive, high-fluence treatments using multiple modes. Deep collagen remodeling can be performed with only the use of topical anesthetic. The versatility of these modes allows for a better provider and patient experience, as you will see through the event this evening. Without further ado, it is my honor to introduce our UltraClear expert and speaker this evening, Dr. Paul Friedman. Dr. Friedman is a board-certified Houston dermatologist and the director of Dermatology and Laser Surgery Center. He is also the past president of the American Society for Laser Medicine and Surgery, the world's largest professional organization dedicated to promoting excellence in the field of medical laser and energy-based applications. As a leading authority on skin rejuvenation and minimally invasive cosmetic procedures, Dr. Friedman is an experienced researcher and physician in the field of dermatologic surgery. He has been featured in several media outlets and is a frequent guest on Dr. Radio's dermatology show. Dr. Friedman is dedicated to research and patient education, which is evident in his prolific authorship of over 100 medical articles and textbook contributions. He co-wrote Beautiful Skin Revealed, The Ultimate Guide to Better Skin, and is co-editor of the textbook Lasers and Light Source Treatment for the Skin. Recognized by Newsweek as one of America's best cosmetic dermatologists of 2022 and 2023, we are excited to welcome Dr. Paul Friedman to share his experience with laser coring on UltraClear. Thank you for joining us, Dr. Friedman.
Thank you so much for that warm introduction, Cassandra, and thank you everyone for joining us here in Houston, Texas, where I've been practicing for over 22 years as a board-certified dermatologist. Our team prides itself on providing cutting-edge and clinically proven technology to a variety of patients of all skin types and ages, as well as performing clinical trials to help advance the field of laser medicine surgery. During our virtual event today, I will be covering the advantages of the UltraClear 2910 erbium-doped fiberglass laser technology. Additionally, we are thrilled to share our early experience in histological evaluation of the latest mode on the UltraClear laser known as laser coring, This technology is the latest advancement in tissue coring, utilizing laser-enabled, first-of-its-kind tissue coring. Fractional laser resurfacing has been a workhorse in our practice since the advent of both non-ablative and ablative fractional technology. When utilizing current ablative fractional resurfacing modalities, a major limitation has been the need for pain management measures during the procedure. With the launch of UltraClear, our practice has been exploring full capabilities of the ablative fractional 2910 erbium-doped glass fiber laser technology for advanced signs of photoaging, scar resurfacing including burn scars, as well as photoaging in skin of color, and most recently laser coring. The technology has proven to be very versatile with an excellent safety profile in all skin types and ages, and has been well tolerated by our patients with only the use of topical anesthetic or occasional nitrous oxide. We will touch on each of the advantages shown here on the right throughout the presentation. As seen in this water absorption coefficient diagram, the 2910 fiber laser operates at a peak water absorption, allowing 95% of energy used to ablate the skin, leaving minimal residual thermal impact in the surrounding area. Tiny layers of tissue are removed with only a few microns of residual thermal damage. The avoidance of bulk heating increases safety as well as decreasing the risk of pigmentary side effects. This slide demonstrates a comparison of fractional ablative technologies of the erbium YAG, CO2, and UltraClear fiber laser from an aerial view, demonstrating the relatively small spot size of the UltraClear as compared to these other technologies. Based on a 10 by 10 pattern size shown on the left with 2% coverage, the 2910 fiber laser delivers a very small ablation channel of 170 microns, ultimately promoting rapid healing with less discomfort. The smaller spot sizes of the UltraClear laser correlate to what we are seeing firsthand, with patients reporting lower discomfort scores and more rapid healing compared to traditional fractional ablative resurfacing procedures. Moving to the right, this illustration demonstrates ablation versus coagulation as compared to the erbium YAG and CO2 lasers, highlighting the coagulation or thermal impact along the ablation channel. As compared to the erbium YAG, which has a low thermal impact, and the CO2, which has a high thermal impact, the UltraClear fiber laser can be customized with adjustable coagulation based on the patient's baseline condition, skin type, as well as tolerability for downtime. Another novel aspect of this 2910 nanometer fiber laser is the pulse delivery, which will be discussed on the next slide. These thermal coagulation pulses are delivered in the same ablation channel and in the same pass, applying direct coagulation to the wound, ultimately promoting hemostasis. The diagram shown here demonstrates one of the most exciting aspects of this technology, which is the 3D IntelliPulse blended pulse technology. The graph on the left shows conventional lasers which deliver energy in one pulse, as contrasted with the picture on the right demonstrating a customized blend of 4 ablative micropulses consecutively in the same 170 micron channel delivered by this novel device. With thermal relaxation time between each pulse, pressure and steam have time to escape the channel, resulting in a more comfortable patient experience. Finally, the histology image on the far right demonstrates that this blended pulse technology delivers multiple stacked coagulative pulses consecutively within the same microchannel. So as mentioned, there are several advantages of the technology, including the 2910 nanometer wavelength, the small spot size, and as shown in this video, 3D IntelliPulse technology. In our practice, our older demographic patients tend to request more aggressive, customized treatments to address advanced signs of photoaging. To achieve similar results, traditional ablative fractional resurfacing treatments would require more advanced sedation and discomfort measures, whereas with UltraClear, we typically only use topical anesthetic with occasional use of nitrous oxide, ultimately helping with patient flow, treatment times, and overall patient experience. As you will see in subsequent slides, downtime is also notably less compared to other ablative resurfacing technologies. Capturing these ultra-clear resurfacing pulses on paper with a slow-motion camera allows us to visualize the delivery of superficial and deep micropulses in one pass. The engineered smart pulse algorithms allow for rapid delivery of the rings and deep drilled pulses. This 63-year-old female with Fitzpatrick skin types 2 was treated with a high-fluence, multiple-pass treatment with customized ultra-clear resurfacing modes. Looking at her healing progression immediately post-treatment, we note moderate erythema, superficial crusting, and mild oozing. Her home care included vinegar soaks and healing balm. At post-op day number 3, you can see closure of the channels and almost complete resolution of erythema by post-op day number 5. In this 77-year-old female with Fitzpatrick skin type 3, before and 13 weeks status post 2 high-fluence customized ultra-clear treatments, you can see significant improvement in texture, lines, and wrinkles, with notable improvement around the nasolabial fold and lateral cheeks. And here, in this case of a 73-year-old female with Fitzpatrick skin type 2, status post 1 high-fluence customized ultra-clear treatment, you can see significant improvement of skin laxity and rhytids. Our practice has been very pleased with the degree of improvement, especially considering the decreased discomfort and downtime compared to other fractional ablative resurfacing technologies. This lovely 68-year-old female with Fitzpatrick skin type 2 is a Houston-based social media influencer. She chronicled her one-week healing progression following ultra-clear treatment. As demonstrated, we typically see erythema and edema peak around post-op day number 2, with a dramatic improvement in healing on post-op days 3 through 5. And here are Shishi's results 3 months status post 1 high-fluence ultra-clear treatment. She was very happy with the overall brightening of her skin, as well as improvement of the photoaging lines and wrinkles. Pictured here is a 59-year-old woman with Fitzpatrick skin type 3 who presented to our office with a traumatic atrophic scar on the left upper lip, medial fold extending to the lateral cheek. And here she is 7 weeks status post 1 ultra-clear treatment with significant improvement of the scar. Of note, early results for burn scars treated at our practice, including pediatric burn scars, have been very encouraging, with demonstrated increased range of motion, as well as obviating the need for analgesia with large treatment areas being performed after topical anesthetic only. Our practice has been very excited about the newest mode now available on the UltraClear system, which is laser coring, and the potential clinical applications, including seeking FDA clearance for improvement in skin laxity. We have been actively exploring this mode for treatment along the jawline and neck, with only topical anesthetic and occasional nitrous oxide. This innovative mode delivers energy in a unique pattern, creating large microchannels with minimal pinpoint bleeding. As one of the first practices in the world to utilize this mode, our early experience has been quite positive, and we are exploring the clinical applications while also analyzing the histologic impact in the tissue. The image on the left demonstrates the laser coring pulses being laid down in a flower pattern, creating a large diameter channel delivering energy in the 36 micron deep layers in a spiral pattern, ultimately avoiding bulk heating. The 5,000 Hz rapid delivery of these pulses in multiple layers also leads to increased patient comfort versus removing the tissue with a single pulse or hollowed out needle. With the ability to adjust the pattern shape, size, percent coverage, and depth, we can avoid overlap and increase safety as well as consistency. Demonstrated in the slow motion video shown, the laser coring pulses are being delivered into plexiglass. The ultimate goal of laser coring is to remove the largest diameter core possible without exceeding 400 to 500 microns to avoid the risk of any scar formation. The UltraClear laser coring mode delivers a pulse that is estimated to be 360 microns in diameter. Shown on the right are preliminary laser coring histology images from our center, which shows an individual laser core diameter of about 258 microns, which is likely due to the tissue coagulation and contraction. Additional histology samples are being evaluated at our center as we speak. We believe the controlled coagulation aids in hemostasis, healing, and overall patient improvement, and look forward to publishing this data around this new novel technology. The ultra-clear laser coring guided user interface is easy to navigate with the ability to adjust percent coverage and depth. The laser coring is easily incorporated into ultra-clear treatment plans utilizing a single handpiece with no consumables, allowing the provider to easily move between all ultra-clear modes. Ultra-clear laser coring is especially easy to use in hard-to-reach areas such as the submental, jawline, and jowls. Overall, with laser coring, we are seeing less bleeding and discomfort, with patients recovering relatively quickly and reporting high patient satisfaction. We will now begin walking through the customized ultra-clear and laser coring treatment performed in our practice, highlighting the patient journey. Upon patient arrival, the skin is cleansed and patients are educated again on what to expect and consent forms are completed. We then take a series of Visia and IntelliStudio photos capturing multiple angles. When assessing patients, we create a customized treatment plan taking into consideration the patient's skin type, degree of photoaging, skin laxity, skin thickness, and tolerability for downtime. Following a laser coring pulse, a punch biopsy was performed in the submental area to analyze the microchannels. As shown here in the submental area, this innovative mode delivers energy in a unique pattern, removing a larger column of tissue. The downtime with laser coring is slightly longer as the microchannels are larger, but overall patients heal relatively quickly. Targeting lines and wrinkles around the mouth, we started with the deep mode, utilizing blended ablation and coagulation pulses. The pulses are delivered precisely and quickly, leaving a visible pattern on the skin. Throughout the treatment, we utilize saline-soaked gauze and frozen peas to cool the treatment areas for patient comfort. Due to the 2910 nanometer wavelength, small spot size, and blended pulse technology, we have not seen lines of demarcation, hypopigmentation, and patients have been recovering quickly. The lightweight handpiece allows for easy access into hard-to-reach areas around the eyes, nose, and forehead. For missed areas, the pattern size can be made smaller to fill in the gaps. To accommodate for thinner skinned areas such as the neck, settings are adjusted, dialing back the density and depth while still using a combination of ablation and coagulation. We educate patients on increased downtime in these areas as redness may linger a bit longer as compared to facial healing. Post-procedure, the patient demonstrates slight epidermal bronzing, erythema, pinpoint bleeding, and swelling in the treated areas. With ultra-clear resurfacing alone, patients see noticeable improvement in post-treatment edema and erythema by post-op day 7. Especially incremental improvements are seen between post-op days 4 through 7. In areas treated with laser coring, our patients are experiencing edema and erythema, typically resolving 1 to 2 weeks status post-treatment. Patients have reported a noticeable improvement of advanced photoaging after a single session, with some opting to do 2 to 3 treatment sessions for further improvement. Typically, results are appreciated within days or weeks following treatment, and neocollagenesis is expected to continue several months post-procedure. On post-op day number 2, patients typically experience peak swelling and redness, and as you can see here, we have seen dramatic healing by post-op day 7, with notable improvements specifically on days 5 through 7. The photo on the left shows typical tissue appearance immediately post-laser coring only. Erythema, edema, and pinpoint bleeding are expected, and bleeding typically resolves quickly. In our practice, laser coring is performed in conjunction with all other ultra-clear resurfacing modes as shown on the right. Moving forward, looking at some of the early laser coring results, this 68-year-old female with Fitzpatrick skin type 3 was treated utilizing high-fluence customized ultra-clear modes on her face and neck, while laser coring mode was utilized in the submental and jawline area. Here she has 2 months status post 2 treatment sessions with nice improvement of skin laxity along the jawline area. Here we see the same patient from a profile view with noticeable improvement in the submental and jawline areas 2 months status post 2 ultra-clear treatments incorporating laser coring. This 73-year-old female with Fitzpatrick skin type 2 was treated using high-fluence ultra-clear modes on her face and neck and laser coring along the submental jawline and jowls. And here she is 6 weeks status post a single treatment session with early improvement along the jawline.
Hello, everyone. I would say good evening, but I know we have people tuning in all over the world, so thank you for that. I'm just going to make sure we have excellent. Hello, Dr. Friedman. Hello, Dr. Murray.
Hi. I love the emojis. Keep them coming.
Well, that was great results. And first and foremost, thank you, everybody, for joining us. We're thrilled to have you join us at this live event, and we're thrilled to share with you some of the preliminary work done on laser coring. So with that, I'm joined live for this virtual event with Dr. Paul Friedman, board-certified dermatologist in Houston, and his cosmetic fellow, Dr. Taryn Murray, who, might I add, is joining the Department of Dermatology at the Cleveland Clinic in Ohio this fall. So congratulations, Dr. Murray.
Thank you.
So we've had a lot of interest throughout the presentation. So I say we just dive in here. We have a couple of reoccurring questions. So I know that during the presentation, you guys mentioned a little bit about this, but some people were asking, what is the type of topical or type of anesthetic that you're using for this procedure?
You want to go? Sure. So we use a compounded benzocaine lidocaine tetracaine cream. And occasionally patients will utilize nitrous oxide, but the overwhelming majority of patients are comfortable with just the topical numbing cream.
Excellent. Okay.
But we typically will caution patients that they can expect a little bit of more discomfort with the coring settings.
Mm-hmm. Excellent. And it's nice to hear that it's just that topical or, no local needed. Another recurring question was, what is the patient experience? So we did see the live demonstration, but what is the feedback that is given from your patients post-procedure?
So most patients do comment that they feel like the area feels tighter, looks tighter, that friends and family have noticed they had something done. Maybe they can't put their finger on it, but say that they look great. And everyone's been really pleased with their results so far.
So Dr. Murray's been with us a year. She's been overseeing the clinical trials. And so, it's not uncommon for those particular patients to be especially excited, but I mean, it's been consistent with her demographic. In clinical practice, we've had similar experience. Obviously, those patients are more demanding when they're paying for the procedure. And I think, setting realistic expectations in terms of the recovery. And as we get into these more aggressive modes, as we got more comfortable with the technology, our patient satisfaction scores have gone up subsequently. And I think that's where it's going to be so critical with all the different modes and the customability of the technology, being able to tailor that to the patient's tolerability for downtime, their condition and their skin type is going to be critical in making sure your patients are getting the best possible outcome.
Excellent. And that brings us actually to our next question. Do you, for skin of color, because you have a lot of skin of color in your practice, are you utilizing laser coring on darker skin types? Have you done that yet on a skin type 5 or 6?
Yes. Yes, we have just a few.
Excellent.
One 4 and 1 5 so
Yeah.
far.
So, I mean, it's a good question. Obviously, the concern in darker skin type is post-inflammatory hyperpigmentation. So we're treating a little bit more cautiously.
Yeah.
And obviously, in that demographic, those patients tend to be less concerned when it comes to skin laxity. But our early experience has been very positive, but we're being more cautious with the amount of coverage that we're utilizing.
That makes sense. Excellent. And similar, a little bit more, pertinent question. We talked about the different modalities, right? The different modes on the ultra clear. So obviously we're referring back to laser coring, but there's a question here for burn scars. Which is more effective? Are you using the ultra mode, so obviously the deep drill, or are you using the laser coring mode?
You want to start with that?
Yeah, for most scars, including burn scars, we've been utilizing the regular ultra clear modes predominantly. I think where we've seen laser coring be really helpful in scars is when they're thicker and more hypertrophic, because then it can help debulk the tissue a little bit. But we've predominantly been doing the normal ultra clear modes, and then with both modes, we've tried some laser assisted drug delivery as well.
Yeah, so for those of you who are able to attend ASLMS, the annual conference in Phoenix this year, Susie Kilmer presented some of her early work using the ultra mode. She's at about 2% coverage, and some of the results she was showing for burn scars was fairly dramatic. And I think where she's most excited is in the pediatric population. The ability to treat larger areas with just a topical anesthetic for analgesia is really where this technology is making a tremendous, and it has the potential to make a tremendous impact.
Very well said. And I think to elaborate on that, Dr. Friedman, when you're mentioning Dr. Kilmer, I know that a lot of pediatrics, she's not even using topical anesthetic to treat scars. And that's the beauty of this, having them come into the practice. They're obviously scared, they're nervous about getting a procedure done. So being able to treat them rapidly, not having them numb for 45 minutes is truly a game changer, not only for the practice, but also for the patients. So we saw obviously the live demonstration. We saw a little bit of pinpoint bleeding post laser coring. Can you talk or elaborate a little bit? How do you manage any bleeding that occurs post procedure if you're getting any bleeding post laser coring?
So while we perform the procedure, on our tray, we have ice packs and saline soaked gauze. And if there is some bleeding, we'll just use compression with the saline soaked gauze and the ice. And it usually resolves very quickly. We haven't had any patients experience any bleeding once they've left. That hasn't been an issue. It's just very, very brief while we're performing the procedure. And not on every patient, just a few here and there.
Yeah, I'll just echo what Dr. Murray is saying, and then just some practice pearls for some of the audience. Looks like you have a great attendance, so congratulations. Would be especially for this mode, you're going to want to have a assistant in the room for a couple of reasons. One is we're using the smoke evacuator throughout the procedure, and then definitely the assistant can help with compression as you're moving on to other regions for treatment. Some other things that I think are important to mention, as we start talking about the coring. Basically the whole coring concept is scarless skin removal. And Dr. Anderson published some of the initial work showing that you want to be below about 500 microns when, to prevent, so that you don't form a scar. And I think, the goal with Shlomo, who invented the technology, was to get around 380 microns to 400. And some of our histology are showing that we're close to that, but there's also some more contraction that we're seeing as well. So I put up that initial histology, and we have literally data coming in as we speak. But what I really want to emphasize is, as has been mentioned for other coring modalities, is you really want to be careful with your technique and not overlap, because that's where it's going to be critical in terms of avoiding any scarring.
And then speaking of overlap, so one of the questions here, because we saw you doing, the submental treatment, and then after using the other modes as well, are you utilizing, a different mode and laser coring within the same setting on the same area? And if so, would you do the laser coring first, followed by the other mode, or would you do your ultra or your ultra clear mode first, followed by laser coring?
Yeah. So even though
Before she answers, we've given a lot of thought to this question.
Yes,
so your audience should be very
Yes.
grateful. We're about to share with them about a year's worth of work. Go ahead.
So even though in the video I was performing clear first before I did the coring, it actually works better if you do the coring first. I think if you perform the clear mode first, even though it's mostly ablation with very little thermal impact, I think there is some heat in the skin causing vasodilation, and we found that there's more bleeding that happens if you do the clear first. So we recommend doing the coring first and then clear over top of that area. We do think it's important to do that second pass with clear because we've seen it helps with overall healing and just helps keep everything blended, so you don't have any demarcation lines.
Excellent.
Yeah, so just to expand a little bit and kind of just go back to some of the early days with the technology and interaction with the medical advisory board and other thought leaders. In terms of their early experience, they were concerned about kind of some of what they were seeing in terms of imprinting. It was resolving, but that they were starting to see it about 3 to 4 weeks. And so, we developed the concept of, as Dr. Murray described, doing this superficial exfoliation pass over the coring to basically help with epidermal cell turnover, and that's basically eliminating any visualization of any imprinting, so to speak. And I also think, we've also kind of fine-tuned the depth that we're going at. I think there's a role to going a little bit deeper to avoiding that imprinting as well. Would you agree?
Yeah.
Well said. And I think that's consistent across the board with those who've dabbled in with laser coring so far are saying the same thing. So a little bit higher density residing in the clear mode and a little bit deeper in that clear mode as well for a second pass. Now, I know that you've mentioned this, obviously faster healing and the pain, is minimal when it comes to ultra-clear versus other ablative technologies. But how are you managing the pain, if any, during the treatment or after the treatment is performed?
So during treatment, we have patients numb for about 45 minutes to an hour, especially if they're going to be getting the laser coring. We try to have them numb for an hour. Then they have the option of nitrous oxide, but most patients say it's a little spicy, but everyone's found it tolerable. And then interestingly, virtually no patients have had any pain post-procedurally. There can be a little discomfort during the treatment, but that resolves very quickly. The most common complaint is kind of a sunburn or burning-like sensation, which resolves very quickly. And then after that, there's really no pain post-procedurally.
I do think it's important, Dr. Murray, that you share your experience having had the treatment. And it's something, I think it's important that, so what you tell patients on the day of, because as someone who experienced a little bit of discomfort, you want to share that?
Yeah. So I've tried it. So now I feel like I can effectively counsel our patients on what to do post-procedurally. So it does feel hot afterwards. It resolves fairly quickly. We tell patients to avoid washing their face for the first 24 hours and just to use vinegar soaks about 3 times a day for the first several days. And then they can take Tylenol if they're having any discomfort, but most patients have been pretty comfortable. They look pretty beat up. They're red and swollen, but there's not much discomfort actually.
And then the day of your, in terms of avoiding, cleansing the face or any.
We give them, we tell them products they can use, products they can avoid. We like to use a post-procedure healing balm. We tell them not to wash their face for the first 24 hours and stick with the vinegar soaks for the first 3 to 4 days.
And so all that has really been helpful in terms of making the post-operative course well tolerated. And we don't get any calls. I mean, I think that's the key, as well as we have the patients prepped in advance, and then we haven't had an opportunity to mention it yet, but we do prophylax all of our patients for HSV, starting the day of the procedure and continuing for up to a week.
And well said. If I can elaborate as well, a lot of our ultra-clear users, same thing. Post-procedure, we tell them not to do anything for 24 hours, use a gentle cleanser the following day. We've tried a lot of post-care, ultra-clear treatments, whether it be with laser coring or just the other modes. So I want to emphasize that patients are healing so much faster, and you don't need to put anything post-procedure for 24 hours. It's going to give you the best outcome. It's going to prevent that lasting erythema and edema. So I think you guys hit the nail on the head there. So I think we might have mentioned this during the demonstration, but are you guys using the laser coring for vectors at all? And if so, where are those vectors performed? Or are you doing full face, lower face? Where exactly are you treating with laser coring?
So we're mainly treating zones. We're treating zones typically along the jawline, the submental area. As shown, we've done some jowls. I think it's a little too early in terms of, at least in our hands. Go ahead.
Yeah, we haven't tried the vectors yet, but I know some physicians are
exploring that. It's just based on our experience with previous technology. I'm more excited about the treatment approach that was described in the talk, and I think just reinforcing what was said, because I can see some of the questions coming in as well, in terms of the difference from some of the other coring modality. Another coring modality that's out there is, we are seeing some coagulation, as was shown in some of the histology that was presented. And so we think that that's contributing to some of the tissue tightening, that some of our early observations, and explaining why the hemostasis is so well controlled and less of an issue. And so I think that's an important distinction, that this is laser enabled tissue coring.
Excellent. And we're excited.
Versus mechanical.
Exactly. And we're excited, from a Claro standpoint, to have Dr. Friedman and Dr. Murray, be some of the first to do the histopathology when it comes to laser coring. So we'll be able to truly identify that data when it comes to the heat pertinent into the skin. This is not necessarily a question for laser coring, but since we talked about some of the other modalities, have you treated any or pre-treated, I guess, when treating these conditions, lentiginous, melasma, pigmentary disorders? What are you using for pre-treatment, if any? And two, have you had any cases treating melasma with UltraClear?
I mean, we could give a whole lecture on melasma, and as a general rule, we kind of pride ourselves on practicing in Houston, and with the diversity of the patient population that we see, and with the weather being what it is, it's something that we're very cautious about treating. We start with behavioral modification. There's a number of different types of skin brighteners that are now available that we're really excited about. We're seeing really dramatic results with just good skincare and behavioral modification. We're not big fans of treating melasma with energy-based devices during the summer months. We have the luxury of having expertise and experience utilizing lower energy devices for melasma. So this is, as I mentioned, as you mentioned in the presentation, where this technology is really shining is in our older demographic, who perhaps would have required more advanced types of sedation to achieve these types of results with more significant downtime. For a practitioner who doesn't have the luxury of having several different devices, I mean, we're happy to come back and talk about our experience with Skin of Color, but it's a whole different approach and utilization of the technology.
Well said. And then for laser coring specifically, and then maybe we can address, the clear mode as well. How many treatments are you doing for your patients? Are you doing just one single treatment for laser coring? Are they coming back for 2 or 3 sessions? And then if we can talk about also the clear mode, maybe the 3D Miracle, how often are you performing those treatments?
Yeah, so I think for most patients, we tell them they might be able to see the effects after one treatment, but it's probably more like 2 to 3 where they're going to get noticeable results. And I think the photos we showed, most patients had 2 treatments for those results.
So I saw Dr. Lupo had asked a question about the second pass that we're doing with the clear. So we're doing the actually Clear Plus at about 30 microns. And anywhere between 30 to 40% for our coverage. Again, trying to get that superficial exfoliation to minimize any imprinting.
And I would say if you're doing the coring on the face, I would use a clear depth comparable to what the rest of the face is being treated with, and then for the submental area more similarly to what you would use on the neck.
Excellent feedback. One question here, what aftercare are you using? I know we talked about, how to manage the pain, and obviously we said nothing post-procedure, but are you using any aftercare after the laser coring? And are there any consumables?
Go ahead.
The only aftercare that we recommend for the first about 3 to 4 days is the vinegar soaks, and we have patients use the elastin healing balms.
Right.
Yeah, the elastin healing balm, and we even create a nice post-procedure kit for them, so they have everything they need. And like Dr. Friedman mentioned, it sort of minimizes any questions or calls that we get. And then there was the question about clear mode.
Yeah. How often would you be doing a clear mode? For example, a 3D Miracle, how often would you perform that?
I mean, typically monthly. We can get every 4 to 6 weeks. I mean, darker skin types, we tend to lengthen the intervals to about 6 to 8 weeks.
Yeah.
But again, I think, in terms of what we're talking about today, I think that the ability to customize different areas of the face. So, we're typically utilizing the ultra clear and the ultra settings, in the perioral and orbital areas, focusing on coring in the jawline, submental area, and then for the rest of the face, being a little bit more conservative with the ultra density, but utilizing the clear mode to address more superficial concerns. And so,
Exactly.
Again, I think, when you're, for some of the newer users, you're going to want to have somebody to help you kind of document what you're doing in each of the areas that you're treating, because there is this ability to kind of customize based on the various areas of the face and being able to document that.
And I think that's the beauty of it, is the versatility of the laser. So if you are, some practices in Dr. Friedman's practice, obviously you guys are more aggressive, like you said, elder population. So you're going pretty aggressive when you're doing your treatments. I think for those of you that are doing more superficial treatments like the 3D Miracle, which is only 10 microns, no consumables on any of these treatments. But the beauty of it is, yes, you're going to have, that social downtime, and you're performing these treatments every 4 weeks. Very rapid healing, but you still want to allow that 4-week mark to allow the skin to heal and to turn over, and then to be able to treat again. For the more aggressive treatments, how often are you performing those treatments, whether it be ultra clear modes versus laser coring? Is that every 6 to 8 weeks?
Yeah, roughly 6 to 8 weeks. We haven't been doing it any sooner than 6 weeks, probably 6 to 8 on average. And then just to add on to what you just said, it's really nice too. When you're using the device, you can go back and forth between the coring mode and the other modes, and you don't need to switch out the handpiece or do anything differently. It's all just on the screen. You can go back and forth very easily.
Yeah, that, to answer your question about there's no additional consumable.
Yeah.
Excellent. I love
I
this
would say
question.
Dr. Murray's research patients have been so excited. I mean, they're looking to come back in for more treatment.
Yeah.
That's great feedback. I actually love this question. So we've gotten a couple different questions asked a different way, but I'm always about combination therapies, right? You were just alluding to this, Dr. Friedman. You have a lot of technologies within your practice, a lot of post-care. One of the questions, and it's starting to emerge a lot more at our talks and within practices, are you mixing or utilizing any exosomes or PRP or doing any hair restoration post-procedure as you're creating these channels, whether it be laser coring or with the ultra mode? Are you utilizing any of this post-procedure?
Yeah, so certainly for our, where we find it most useful is for our patients with either atrophic scarring, we're utilizing poly-L-lactic acid, and then our patients with burn scars, we're typically using 5-fluorouracil topically immediately after the treatment.
And we've done PRP as well.
Mm-hmm.
And we've done PRP as well.
Perfect.
Just based on experience with other ablative fractional resurfacing devices, the application of PRP really hastened the response time in terms of the healing time. Again, this is, as I showed in the photographs, is a more controlled type of coagulation to ablation ratio. So the healing in general is quicker, but if for somebody who, wants to get perhaps some additional benefits from applying, PRP or more advanced accelerated healing, there could certainly be a role for that.
Well said. And then now talking more about now modalities in terms of technologies. Are you doing any combo therapies with any other type of?
You just
You
froze.
said, have you used any pulse light treatments?
You just froze for a second, but I think you said combining it with treatment. I mean, yeah, I agree with you. I mean, we're combination treatment plays a big role in our practice as well. And so, like for instance, a patient yesterday had some areas, where some subtle areas of melasma associated with other signs of photoaging. So we combined it with a lower energy density 1927 for those areas of pigmentation that we were concerned about, and then treated other parts of the face with the ultra clear. We have combined it with pulse dye laser. We'll do the pulse dye laser first, but we didn't show that slide in this presentation, but we have seen examples where telangiectasias have improved, kind of as it was an unexpected result, but probably as a result of some coagulation of those vessels. And then, I guess for some of the lower modes or we'd be comfortable doing injectables on the same day, but I'm very careful with cooling the skin after any energy-based treatment before doing any botulinum toxin injections to minimize the risk of any diffusion.
Excellent. And I know some of our practices are combining RF microneedling, with the ultra clear laser. I know that some practices are also using some of the tightening devices or the lifting devices with ultra clear as well, same patient, same day. So definitely we're all about combination therapies. So thanks for elaborating on that. And I know you've done some scars, I've seen some of your results on the arms, on the forearms, off face. So are you doing any treatments off the face, on the body at all with ultra clear?
Yeah. Mm-hmm. Yeah, I think we've treated on the abdomen, on the arms, on the legs. I mean, basically everywhere we've tried it out.
Yeah, I would say the most common areas are the neck and the décolletage area in combination with the face. But we're very careful with some of our for patients who are receiving initial treatment. It can be a bit much at the settings we're utilizing to do beyond, say, the face or, face and neck, especially with the associated wound care. Because as I said, we're pushing this technology as far as we can. And so that's something that plays into our decision about, doing more than one area at a time.
Well said. So someone's asking, and we touched on this a little bit, but what's the difference between the ultra mode and the coring mode?
Yeah, so the biggest difference is going to be the size of the ablation channel, and so and it's going to be the mechanism of delivery in terms of the spiral. We showed the flower pattern of how these channels are being laid down to basically in a way to create these larger ablative channels. And you're also getting more in terms of coagulation, we're finding, still in an 80-20 ratio, but ultimately you're going to be seeing with an ultimate result of a little bit more in terms of downtime and a little bit of tissue tightening that you're not going to see with the ultra mode. Would you have anything else?
Yeah, and the depth settings are different as well, in addition to the diameter. So the maximum depth that you can go for the ultra clear or ultra mode is 1500 microns, whereas the coring goes to 4000.
Excellent. And to elaborate on that flower pattern, so basically you have 170 micron spot size would be your ultra, and then you're performing about 6 different ultra kind of points in a flower pattern to create, I think you alluded to this, Dr. Friedman, is 360 to 380 spot size for the laser coring mode.
Yeah, so as we said, just to reemphasize, with the laser coring mode, you're not going to want to, any overlap. You're going to be very careful because you will see a little bit of contraction when you're actually doing the treatment. So you're going to want to make sure, just as been emphasized with mechanical coring, with this laser-enabled coring, you want to be very careful with minimizing any overlap. As we discussed earlier.
And how is laser coring different than any other skin rejuvenation technology or anything you've utilized in the past?
I mean, this is a whole new platform. This is something that we what's unique here is that you have the coagulation and the ablation being delivered in the exact same channel, and there's several advantages of that, and I think explains some of the early results that we're seeing. But ultimately, the size of the ablative channels that we're able to, as I mentioned earlier, our goal is to remove skin in a safe manner and cause a little bit of contraction at the same time. So we're getting some tissue tightening. Other technologies that are used, for these purposes have been, either radio frequency or high intensity radio frequency with microneedling. So this is using a laser enabled platform for surgical skin removal. Would you add anything else?
Yeah, and I think there's a couple other benefits as well. One is that it's very consistent. I mean, you can see it with your eyes where the cores have been laid down. So there's no confusion of, did I get this area? Where do I need to line it up? It's much more clear cut. Plus, I think it's nice to, it's easier to get into certain areas, which we mentioned. And then just the consistency, I think, is huge. You don't have to do nerve blocks or infiltrate the skin with lidocaine. So it's just the patient's in and out of the office much faster. I think there's a lot of benefits, and it really fits in with a whole treatment plan for the patient. You're not just limited to one type of treatment and one specific area. It just fits in nicely with a full face rejuvenation.
And that's what I was going to ask. So I'm going to ask a question. I know everyone else is asking questions, but obviously you have a lot of technologies within the practice. How has UltraClear fit into your practice? And has it changed, some of the treatments you've been doing in the past or been able to treat your patients now moving forward?
I mean, I think the cases we showed were where this technology in our hands has really shined. That social influencer, she. I mean, this is a woman in her 70s, and then we have other patients in their 80s who now have a treatment option for advanced signs of photoaging that doesn't require what we would utilize in the past would be propofol. So to achieve these types of results with the traditional devices that we were utilizing, just because of the way our practice is run and how busy it is, it made the most sense to have an anesthesiologist come in and administer propofol once a month. We would do several cases, and then we would be seeing these patients back every day over the course of until at least a week. Where this has changed our practice is we're no longer bringing in this anesthesiologist. The patients are coming in and being treated, getting in our experience similar types of results without the need for more advanced sedation in our older demographic. And finally, what we haven't even touched on is the ability now for the technology to deliver fully ablative mode, which I wouldn't emphasize that. So we have patients now with rhinophyma, with epidermal nevi, that we're treating using the fully ablative Erbium mode, and we'll share some of our before and afters. So that's a whole nother patient population that we're now able to address with this same technology. So I think that's where this technology is really integrated nicely. Would you add anything else?
No, I think that's perfect. Yeah.
And that's going to be our next webinar.
Say again?
I was going to say that's our next webinar, rhinophyma cases. Just everything you're doing with the technology is phenomenal. So another question that resulted from what you just said is, are you using the coring on any stray, on any areas of loose skin on the body?
We've talked about it, but we haven't. I think we've been really focused on, I think where we are right now is we're really, really focused on getting histology and publishing our results, because this kind of questions that, we're getting tonight, we got at the ASLMS conference. And so in our estimation, that's how we're going to validate our findings and our, what we're seeing clinically. And so we're really focusing on reproducing those areas along the jawline, submental area. My sister is a patient. She was the first patient that we treated. Dr. Murray is going to be treating me next week. But, what I've seen in her, I saw her recently about 3 months out, and it is kind of the submental area, some skin tightening in that area. And I think, again, we're learning the demographic, like anything, where this technology is really going to shine. My sister's in her early 50s. And so, somebody with some early signs of skin laxity in their early 50s, I think this is going to be a nice option for those patients.
And what I would add to that is we have treated off face in scars, but not with striae, and the healing time is dramatically longer off face. Even with the coring mode compared to the regular ultra clear modes, the healing time is a little longer on the face. So then off face, it's even longer than that. So that might be a limiting factor to treating some areas off face.
Well said. And as you mentioned, this is obviously data-driven results. We're going to be publishing these obviously soon, or hopefully soon, along with your help. So we look forward, once we get those findings, we're definitely going to be sharing them on a national platform. So we're really excited to share that with everyone. Another question, we just talked about cellulite. A lot of questions, just because there is other coring devices on the market, just high level, what would be the main differences that you're seeing between ultra clear and some other coring technologies on the market?
Go ahead.
I think just the factors we touched on before, the consistency of the coring that we're seeing, not needing to do any nerve blocks or infiltrate lidocaine, easier to get into certain areas for the treatment.
No consumable.
Yeah, no consumable, being able to incorporate it into the treatment with the rest of the face. You're not limited to, one device or one area. You can treat the whole face.
I think ultimately what the question is asking is results, which I think that's, and I think time will tell. And, we're going to be presenting some of our findings at ASDS. So, just give us a little bit more time. But in our early experience, we're getting comparable results.
And I had the pleasure of seeing your sister a couple of weeks ago in her practice, and she looks phenomenal. And she told me she was the first patient you treated with laser coring. So I was very pleased to see her, especially her before and after photos. So great job. But with that, I guess one of the last questions before we go, and then we're coming up to our hour here, how long does it take you to perform a procedure of ultra clear, whether it be with laser coring or without laser coring?
You want to start?
I think, I think it just depends on how comfortable the operator is with doing the treatments. I think the more experience you've had, just the faster you are. But I would say probably about 15 minutes for the coring to treat the area and account for maybe needing to stop any bleeding, or if the patient's a little uncomfortable, need to take a break. And then if you're incorporating that with a full face treatment, it's probably going to be, and if the treatment has multiple passes, like it's a deeper, more aggressive treatment, maybe 45 minutes to an hour.
Fantastic.
For the whole thing.
Yeah, I mean, we've that's over the course of several, all of our experience with the technology. I would, for some of your newer or earlier audience who don't have as much experience, I would make sure you have adequate time sectioned off, because there is a learning curve, like with any technology. I do want to emphasize, I feel, we both feel strongly that the laser coring part of the device should not be delegated, is our recommendation. For those offices where that is being considered. And again, as I mentioned earlier, just being able to document the various treatment parameters as you're moving along, adds a little bit of an element of time. And so I think I would initially, starting off, just plan a little bit of extra time, because there's so much you can do with this device. You don't want to be rushed.
Agreed. Very well said. And I think, for everybody tuning in, these were never before seen, before and after photos, never before seen treatments. So, we really got a glimpse into Dr. Friedman and Dr. Murray's practice, kind of what they're doing. So with that, we want to thank you both. This has been extremely educational, extremely helpful. Thank you, everybody, for joining. A reminder that you will be receiving an email or a text message if you want to click to get more information on laser coring or ultra clear as a whole. So thank you both for joining us.
Great.
Thank you, everyone, tuning in. And we look forward to chatting with you soon. Bye, everyone.